Okay, the recording started. So if you want to kick us off, Dr. Cullen, go right ahead.
Great. Happy Friday, everybody. I have a lot to cover. Anthony and I just talked about how much time I should take talking versus taking questions. So I'm going to go really fast. I can talk really fast. Let me tell you what I want to talk about. The normal COVID update, an update on the article that just came out, an update on boosters. And then the last thing I want to talk about just really briefly is West Nile, because we are going to be issuing a health advisory on that. So let's start with the normal COVID update. As you know, we remain in high transmission. As a county, we've had over 133,000 cases, over 2,600 deaths. I caution people that the deaths that are reported daily did not necessarily occur, and most of the time did not occur in the last 24 hours. So some of them are 4, 6, 8 weeks delayed in terms of our reporting. So just be aware of that. About 100% of the variant we're seeing is Delta. The hospital beds remain stretched. You are more than aware of the rural hospital issues for transferring patients into the community. In terms of testing, we are reporting a high number of tests, primarily antigen testing, 2,000 to 3,000 to 4,000 on a regular day. That is about where we need to be. About 2,000 is where we would like to be. Talking briefly about vaccination, you guys track these numbers as much as I do. Today, total 65.5% of people in the county have had one shot, 57.3% have had two. Remember, we use the CDC data tracker for Pima County to do this. What's of interest and is unique for our county is that the overlay between those greater than 12 and those greater than 18 that have had vaccinations reveals a very, very small delta. So in fact, the difference is about 1%. That's a tribute to our county, our community, our schools, which is where we've done the primary number of those vaccinations. We continue to have vaccinations available in the county, and for vaccinations right now, what I'm talking about, first, second, and for those immunocompromised, that third shot that's needed to complete your initial series. Let me go briefly then to boosters right now. As you guys know, this is a moving target. After midnight East Coast time last night, the CDC director issued some guidance that will be the default guidance, I believe, as we go forward. You may be aware there were 4 areas where there was guidance issued. The first 2 are shoulds and the second 2 are mays. I just want people to be aware of this. The should, 65 and over residents in long-term care. We've all expected this to happen. The next should, 50 to 64 underlying medical conditions should receive a booster. All of these boosters are after 6 months, not after 8 months. The next may, 18 to 49-year-olds with underlying medical conditions. That was a recommendation from the ACIP, the Committee on Immunization Practices, yesterday. Finally, the last one, which is a shift, is that you may receive a booster if you're at increased risk, 18 to 64, due to exposure and transmission based on occupational or institutional setting. The impact of this in Pima County, before we had the last May, so the first 3, we anticipated that we would need to give approximately 100,000 shots a month from starting hopefully next week through January. This is based on how successful we were early in our immunization campaign. Some of you will recall our goal was to have accelerated immunization to reach 300,000 by the end of March. We actually met almost 380 to 400,000 at that time. At the current time, we continue to give approximately 9,000 shots a week in the county. Obviously, the vast majority of these shots are still first and second shots. So our belief that we will need to accelerate that to 100,000 shots a month is on top of that 9,000. I would remind people that COVID continues to be a disease of primarily the unvaccinated. So our county, from a public health perspective, is still with a major commitment to ensure people that are not immunized or only partially immunized achieve their series. At the same time, we are responding rapidly to the need for boosters. Our understanding is that Walgreens and other pharmacies, including CVS, are allowing people to walk in and get a booster. That starting tomorrow, they will have registration available. We will be expanding our direct delivery of vaccines using our current infrastructure, which is our 3 Pima County clinics, as well as our vaccination site at Abrams. We do expect every other healthcare provider who is in the county that has been delivering COVID will quickly flex to now be able to do the boosters. We are waiting for a few more specifics from CDC for guidance about the booster itself, but we anticipate that we will get that in the next few hours. So by Monday, from a county perspective, we should be ready to go. Our phones have been ringing, as I'm sure all the pharmacies in town have been ringing. So we're really grateful for this. The one thing I would ask people is, if you know somebody that's not immunized, you're coming to get your booster, maybe you can convince them to come with you so that we can try to get the unvaccinated. Briefly, I'm going to flip to masks. You may be aware, MMWR, early release of an article from data from both Pima and Maricopa. We have been working with ASU on this article for the past few weeks. It is an early release article. It was designed to look at the impact of masks in schools. The significant part of this is really that an early mask requirement seemed to make a significant difference in terms of the number of outbreaks. You may be aware that we ourselves have had at least 76 outbreaks that the health department has declared. What's important to note with this article is the increased incidence of outbreaks in schools that were not masked, 3.5 times the level that we saw in schools that had an early masking requirement. Early masking meant that it was in place prior to the beginning of school. We believe that this once again continues to support our recommendation that schools mask. There is this article, coupled with 2 other articles that came out with the CDC today, continue to support that CDC recommendation and the public health recommendation that we have had since we started. The other thing you need to know about this article is that Arizona schools go back earlier than other schools. Because of that, we were able to have almost 2 months worth of data when this article was written and the data set was evaluated. The last thing I just want to follow up on really quickly is West Nile. We've had 2 confirmed cases. We have a 3rd probable. We will be releasing a health advisory to our health advisory network of providers, reminding people to be aware that West Nile is in the community, predictable because of the monsoons and the increased water that we have. I would also remind people that if there are complaints about standing water or pools, they can call the pima-county-health-department, and we will be able to respond to them. And with that, I did that, I think, in 9 minutes, so I'll stop. Thanks, you guys.
Okay, so if you want to ask a question, please use the raise hand feature on Teams. We had one from Megan, but I do not see her on the call anymore. So let's go to Benito from the Tucson Sentinel.
Hi, Dr. Cullen. Thank you for taking our questions. I'm wondering if you could give an update on ICU bed capacity and how hospitals are doing.
Yes, thank you for that question. Our ICU bed capacity remains at less than 5%. We've been in that same place for approximately the last 4 weeks. The hospitals, and as you know, anything I say about the hospital could change in an hour, right? It's a point in time, but at the points in time that we look, which is once a day, we have seen capacities being reached delayed offboarding, which is when the ambulance are coming in and have to wait. And we continue to get reports from our rural hospitals that they have had difficulty in transferring patients to a higher level of care, which is almost always into the City of Tucson-based facilities. So we remain concerned. Once again, the major component to this situation is staffing. It is not that there's not rooms available or beds available, but it is that the staffing has been limited. As you know, the governor has appropriated approximately $60 million for hospitals to ask for additional staffing. We do anticipate that some of that staffing will be coming to some of the city-based facilities within the next 2 to 3 weeks. Thanks.
Next up is Ryan Fish from KGUN, and then Michaela from KWLD.
Hi, Dr. Cullen. Thank you for taking our questions here. You said you're aiming for 100,000 shots a month through January using current infrastructure. What kind of adjustments will the county have to make in order to ramp up to that, back to that number after not seeing that kind of activity in a long time? And what kind of potential challenges might be there in terms of getting to that goal?
Great question. I can tell you I'm not sleeping again because I'm trying to figure this out. So what we have in our discussions with the state, we have been recommended that the solutions are our current pharmacy and clinical infrastructure, as well as the counties. So our pharmacies have been wonderful partners. The vast majority of our clinical partners have also been wonderful, but to follow up on the last question, the clinical system is stretched. So to ask the clinical system to stand up large points of distribution seems to fly in the face of what we want the clinical system to do, which is provide clinical care. We ourselves at the county are looking at what infrastructure do we need to put in place. I don't have a full answer for that, but when we look at the 100,000, we have all done numbers in the last 24 to 48 hours about how many additional doses our 3 clinics and our Abrams vaccination site can do. We think we can be at about 15,000 more a week. So that would give us the 60,000 if we have the pharmacies stand up some acceleration. And we do know that the pharmacies are reaching out to get additional staff for vaccinations. I think the question that remains is whether we should and or will need to stand up a larger point of distribution similar to what we had in the past when we had 4 points of distribution. We are actively looking at that, and by Monday, I believe we will have made a decision of whether we will do that or not. What we have been thinking about is standing up 2 points of distribution, perhaps each of them not doing the 1,000 or 1,500 that were done before, but perhaps doing 500. I also want to urge viewers that while the recommendation has been given that this should that you can get a booster within 6 months, that does not mean you have to get a booster within 6 months. So for instance, if there is a delay in your being able to get a booster by 3 or 4 weeks because you go on a website to register for an appointment and it says there's nothing available till November 1st, I would urge people to be patient with that and to understand that that 4 to 6 weeks is more than fine to accept in terms of getting the booster. Remember, we are all, the whole public health system is flipping on a dime right now, especially with the addition of the last group of here who may receive our booster because of occupational or institutional setting exposure to COVID. Thanks.
Okay, next up is Michaela from KWLD, and then Nicole Ludden from the Daily Star.
Hi, Dr. Cullen. Thank you for taking our question. So in regards to masking in K through 12 schools, what do you hope that schools that currently have mask mandates, or your advice to those schools, what do you think they will do when September 29th comes around and Governor Ducey's ban takes effect?
Yes, so it's a great question. And one of the goals of public health that we, I think, forget is to help inform policy and action. So what I am hoping is that this article itself provides additional data-driven information to help parents make the right decisions about masking and their students and staff and teachers in the schools. Our role is to help inform the school districts. We recognize that the schools will be in a difficult situation as we move towards the September 29th date. But our hope is that, like I've stated, that this is information that will encourage, cajole, inform people's decision about the role of masking. Masking is critical in schools. It is how we have now been able to show a significant impact on the amount of outbreaks that occur in the classroom. It's important to note that we now believe we have quarantined over, or recommended quarantine for over 8,000 students in the county. That is not done lightly. We are committed to keeping everyone in school. All the districts that we work with are aware that we are doing precision epidemiology. If there's anything we can do to not quarantine a child, a staff, a faculty person, we do it. But there has been significant impact, and we know that without masks, that impact would have been 3.5 times greater. Thanks.
Thanks. Nicole Ludden is next, and Steve Clausen after that.
Hi, Dr. Cullen. I'm wondering if you have any recommendations or advice for those parents whose kids attend these schools without universal masking requirements. What can they do to best prevent their children from contracting the virus in addition to sending their own kids to schools with masks while other students and faculty may not be wearing one?
Yeah, Nicole, this is a great question. I think that we go back to our layered mitigation and remember wear, wash, wait, wear your mask. So you wear your own mask. Obviously, other people make their own decision. Wash your hands, make sure that people are appropriately sanitizing their hands. And then that wait is another opportunity for students. Very, very difficult to do, right? You're with your friends. You want to be whispering and having close times with them. But perhaps another methodology here is to really encourage kids to try to be apart at least 3 feet. And the other thing is to not go to school if you are ill. We have embarked on distributing a large number of at-home BinaxNOW COVID-19 tests. So we would hope that anyone that is ill or doesn't feel well, is unclear if they have allergies or not, and is a student, faculty, or staff, is able to test and use the results of that test to make the decision about being in school. And the other thing we need is, and we have been very successful with this, is cooperation with quarantining. I think one reason for our success, despite the high numbers, is that we are once again looking closely at who and when we decide to quarantine. You know, our quarantine is 7 days for most cases. People test day 5, they're out of quarantine. If you are vaccinated and exposed, named as a contact, you do not need to quarantine. So that, once again, the other thing that families can do is encourage anyone who's 12 and over to seek a vaccination. Thanks.
Steve Clausen is up next, and then Emma Gibson from AZPM.
Yes, good morning, Dr. Cullen. Steve Clausen with the Arizona News Radio Network. What if you could clarify something on the booster shots? As I understand it, the CDC guidance applies to people who receive the Pfizer shot. For people who receive Moderna or J&J, could they get a Pfizer shot? Should they hold off until their particular vaccine has been approved for a booster shot? What is your recommendation for people?
Oh, thank you so much, Steve, for clarifying that, because it's an important point. The approval is for Pfizer. The recommendation as it stands right now is for you to get your booster shot consistent with what you got your first 2 shots, which in this case would be Pfizer. If you got Moderna and or J&J, our understanding is the FDA is actively looking at the data that is being submitted to them by both of those manufacturers to determine what the guidance will be for boosters for that. This whole concept of mix or match, can I do one or the other? I would argue that booster shots are not like your wardrobe. You don't necessarily want to mix and match. You really want to be consistent throughout the 3 shots. So, but you will recall that early on, the only vaccine that was available was Pfizer. Our estimates of the 100,000 per month are based on what the Pfizer early data showed us, but also the assumption that Moderna and J&J will be approved for a booster shot. But right now, the recommendation is specifically for the Pfizer booster. And we would recommend from the health department that you only seek that if you have gotten your first 2 doses of Pfizer.
Okay, we've got about 10 minutes left. Right now, we have 2 people queued up for questions, so there's still time if you want to raise your hand and get in line. We have Emma Gibson next, and then a second question from Benito.
Okay, hi. Emma Gibson, Arizona Public Media. My question is about booster shot distribution, and I'm wondering if it's going to be a one-stop shop type of sign up, or we're still going to be going to all these different agencies.
Yeah, Emma, this is a great question. We do anticipate that people will be going to different agencies. At this point, the state has not indicated that they will be helping coordinate the county response specifically within a county. So for instance, right now in Pima County, we would imagine that people who are seeking a shot, for instance, this weekend, would go on our website where we have a link to where the Arizona website maintains the places where people can get vaccination right now. And as you know, that means you would go to Pharmacy A, Pharmacy B, Pharmacy C, and see if there were shots available at those sites. We do know that most pharmacies have indicated that they are taking walk-ins. I would actually encourage people to make appointments if they can, just so that we decrease any congregation of people in different pharmacies throughout for us at least throughout the county. In terms of the county website, the county provision of vaccines, right now there are multiple ways to sign up through our direct health department and through our contractor who runs our vaccination site at our Abrams building, which is where our public health building is. But it's a very good point. People will still have to seek out a vaccination, especially if they want to schedule it, and it will require multiple clicks. Thanks.
Okay, let's go to Benito from the Tucson Sentinel, and then at the moment, we don't have anybody else behind him.
Hi, Dr. Cullen. I'm wondering, looking at the CDC number for percent fully vaccinated, it's 66%, and it was 66% last week. How does that factor into the county's ambitions for vaccinations, considering the slowdown?
Yeah, Benito, this is the other reason I don't sleep. I just want to remind people right now that once again, COVID-19 cases that are ending up in the hospital and in the ICU and occasionally with mortality are primarily unvaccinated people. So our ability to go, let's say 66% is 12 and over with full immunization. So 2 or more shots if Pfizer or Moderna, 1 shot if J&J. To get that to 85, you can round, it's 20%. We have been going up 0.1% a day. That means it would take 200 days. Way too long to get people vaccinated. So we are, at the same time we are talking to you about boosters, we are also kicking off some additional work for the primary series, which would be the 2 Pfizer, Moderna, or one J&J. That includes us working closely with some community-based organizations to facilitate their delivery of vaccines through the mobile sites that we've had. Some incentives have come into the county, not with county funding, but through Partners in Health, which has been a county partner over the last year. We've also kicked off shots and shops. I have a hard time saying that. We're looking for barber shops that would love to participate with us. There are some financial incentives for that, specifically through some grant money that we have to encourage the on-site delivery of shots in certain shops. In this case, barber shops, nail salons, and anyone else that's interested in being a site for us. If any of your viewers know of them, if they can let us know, that would be great. They can call the health department. We would be more than willing to do it. But this is a critical question. The most important thing I believe we can do as a county is to get the unvaccinated vaccinated. We want to be responsive to the CDC guidance. We know there's lots of concern out there, especially with people 65 and over, or people that are worried that they are in a high-risk situation and they want to make sure they are fully have a full immunogenicity response. So they want a third dose, they booster. We are committed to make that available. At the same time, we will continue our major emphasis on ensuring that people receive a primary vaccination series. Thanks.
We can go back to Steve Clausen from Arizona News Radio Network.
Yeah, Dr. Cullen, I want to talk to you for a moment about testing, which seems to have moved to the back burner for a lot of people. I don't hear a lot of people talking about it anymore. And I tie that in with something that happened just a couple of hours ago. I'm not sure if you're aware of this or not, but The View, which was scheduled to have Vice President Kamala Harris on as a guest today, started the show. There were 4 regular hosts on the show. 2 of them got pulled mid-show because a rapid test shows they had tested positive for COVID despite being vaccinated or having the vaccine. How important is it for people still to get tested even if they are vaccinated, and what does this show?
Yeah, this is a really important question. We are still committed to testing in Pima County. We have stood up testing at our public health department, and we also have a contractor Paradigm that is still providing testing. We have flipped primarily to the rapid test, the rapid antigen test. Lots of reasons for that. We're in an era of high transmission, which means the sensitivity, specificity, predictive value of the antigen test is better because we, sadly enough, have a higher number of cases. We would urge people who have any symptoms at all and or have been identified as a contact to seek testing. In our situation, it is appropriate to use that rapid antigen test. And to go back to something I already mentioned, we are actively distributing at-home testing through the schools. We anticipate that we will be distributing some at-home testing, which is the same test you get if you come into Pima County Health Department right now. It's just certified by the FDA for home use. We would encourage people to use that test if they have it at home. To go back to, we are distributing some of them. We're starting to distribute that to community-based organizations. That's because of equity. Our concern is that if you have a car, if you have resourcing, you can go get testing. The person that may be most at risk may not have access to that, may be working odd hours, may need to be on the bus to get testing. So we believe testing is a critical part of controlling the pandemic. And remember, the reason for that is, and this situation you give describes it, because if you test positive, you then go into isolation and your contacts quarantine. And so traditionally what that does is stop the transmission of the disease. It goes back to that R0 number we've talked about. How many people can I infect if and when I become a case? Thanks.
All right, if you have time, Dr. Cullen, we have a final question from Benita, who's coming back for another one. You okay with that?
Benita. Yeah.
Yeah, thank you so much. Third time's the charm. let me ask, Garcia, you and Dr. Garcia said earlier in the month that you were still going to wait until you could say you've seen the full impact of schools having in-person classes, both at the college level and at the K-12 level. Now that we're further through September, do you think you can say that you've seen the impact it's had?
This is a great question. We work very closely with the University of Arizona, who has been a great partner. I do think we have seen that the impact at the university is minimal. There is impact and there are cases every day, but the university responds rapidly to them. They do case investigation and contact tracing. They work with us. They actually work under us, though we mutually guide each other. So I feel from the university perspective, we are okay. I will tell you the date of September 29th concerns me. I feel like, I don't feel like we have a fairly deep understanding right now of the public-private charter parochial school situation in Pima County, especially because of our relationship with the schools and an understanding of where masking is occurring, where masking isn't occurring, and the belief that the vast majority of schools are encouraging masking, and many are requiring. After September 29th, I think we don't know what we're going to see. And so it'll be interesting. You'll have to give us 2 to 3 weeks after that time for us to be able to predict. I do want to mention this article again. Masking significantly decreases the incidence of outbreaks in schools. Thank you, guys. I hope you have a great day.
Thanks, Dr. Cullen. Let me make one more point about the mask study. For the media, if you're interested, you can email me. I have contacts from the Arizona State University side. They led the study. If you're interested more on the process, how the whole study came together, I can give you contacts for that. And I can also give you contact at the CDC if you want comment from the CDC as to what they think of the study. So other than that, if you want a recording, please leave your email in the chat if you haven't already, and we will see you all later.
Thanks, everybody.